All right. Good morning, everybody. Thank you very much for joining our press briefing here today with regard to the state's response to the pandemic. We have a couple of folks who are going to be joining us here today to talk about different topics. But of course, first of all, we would remind everybody that what we're seeing, and certainly some states are being hit harder than others, but the pandemic is still out there, the virus is still out there. There's new strains we've talked about in the past that are more infectious, so that just is a great reminder for all of us that we ought to be doing all we can to be able to slow the spread of the virus, which means make sure you keep that 6 foot of distance between you and other people when you're out in public. Wash your hands often, that actually kills the virus. Wear a mask when you go to the store. Stay home when you're sick. Avoid the 3 C's. It spreads from one person to another, especially as we're here in the winter months. You may be inside more with poor ventilation, so closed spaces, confined spaces, crowded places, all those things are going to spread the virus more. So please be mindful of those sort of things. And of course, all of this is about making sure we preserve our hospital capacity. Right now, we've got 36% of our hospital beds are available, 35% of our ICU beds available, and 76% of our ventilators are available, so that's all good news. We're sitting at 475 hospitalizations, which is down by half from where we were at our peak on November 23rd of 987, but we want to make sure we continue to preserve that hospital capacity. So please, everybody take steps to be able to slow the spread of the virus. We are going to have 2 speakers here today. First of all, I'll call up Angie Ling, who's our incident commander for the Department of Health and Human Services. She's going to give us a vaccine update. And then we will be talking about Human Trafficking Awareness Day and Month, and then we'll have Attorney General Doug Peterson come up and talk about that. Also, we will have a number of people. Normally, when we do the Human Trafficking Awareness briefing, we bring in a lot of the different groups who are combating human trafficking. That's not going to be possible, obviously, with the pandemic. So we've got some folks that are here. We'll have some folks on the screen. My lovely wife, Suzanne, our First Lady, is here as well. So we'll have some folks here, but we won't have the typical big group that's going to be talking about that. So let's see. With regard, just another thing that you all can do to be able to help prevent the spread of the virus is Test Nebraska. We are still turning tests around very quickly at Test Nebraska. Less than 24 hours, we have delivered over 600,000 tests through Test Nebraska. It's a great way, especially if you're out traveling during the holidays, you suspect you might have been exposed, or if you just want to make sure you haven't gotten it, great opportunity to go to Test Nebraska and get that done. All right, so I'm going to bring up Angie Ling, who's our incident commander for the Nebraska Department of Health and Human Services, to give us a vaccine update. You may all recall that a week ago we said we'll see vaccine production ramping up. We have seen that ramping up. In fact, I think, Martha, I'm going to call on you a little bit. The World Herald story yesterday, didn't it have us ranked number 7 in the nation as far as per capita getting the vaccines out? I think something like that. So it's definitely top 5 or top 10. So Angie, you want to come up and talk to us a little about how the vaccine program's coming?
Thank you, Governor. Good morning. As of last night's update, 76,882 vaccines have been administered in Nebraska, and over 38,000 doses were administered last week alone.
Hey, Angie, actually, I'm going to stop you there. That's through January 9th, right? It was reported last night, but wasn't that through
Correct.
January 9th? Yeah.
Yes, sir. We are one of the top states regarding the percent of doses used. As I mentioned last week, we will be launching a vaccine registration and administration system in late January. This system will allow Nebraskans to register to receive the vaccine by entering some basic information to determine what phase they are in and when their phase is open. Some of that information includes name, date of birth, email address, phone number, occupation, and some health questions. This information is strictly confidential and will only be used to determine phase eligibility and to administer the vaccine. After registering, the person will be notified that they are eligible to receive the vaccine and will either be directed to schedule their vaccination if their phase is open, or will put them on the wait list. If placed on the wait list, once their phase is open, registrants will be notified that they can schedule an appointment either through the vaccine system or with any local providers offering the vaccine. The system includes a vaccine finder to help identify providers who have the vaccine available. Additional reminders will be sent for the second vaccine, and you will be able to enter any adverse reactions. We will also have a call center to assist those who do not have internet services. This system will not be the only method to receive vaccine, as healthcare systems who will be giving the vaccine will be able to schedule through their own systems as well. We acknowledge that the registration system is slightly behind schedule, but we have been working on this for quite a while and want to ensure Nebraska has a sound product so we are not having issues that like other states are seeing. We will be reviewing this product with you in more details very soon. This timeline will not hinder our ability to get vaccines in arms. After healthcare and long-term care residents are vaccinated, age 75 and older population will be up next. There are 3 ways for this group to get vaccinated. This will be through community vaccine clinics in their local health departments, select healthcare systems, and select pharmacies. We are solidifying this list with those providers and are hoping to have this available to the public next week. Local health departments have information on their websites and Facebook pages. We also have the COVID-19 information line that you can call for more information. That number is 402-555-6645 or toll-free 833-998-2275. Rest assured that the local health departments will communicate when your phase is ready through local outlets. We have also been working with the National Guard for a few weeks and are activating another approximately 70 personnel to assist administering vaccinations and support personnel. These members will be working directly with the local health departments. I would like to take some time to clear up some misinformation out there right now. The allocation and distribution process for the state of Nebraska goes like this. We receive our final weekly allocation numbers about 1 week prior to the arrival of product in our state. These numbers are given to us by the Operation Warp Speed team. Once we receive our state's allocation numbers, we are able to start allocations and orders within the state. In Nebraska, we do not have a central location for vaccine. Let me repeat that. We do not have a central location within the state that receives all the vaccine product. The allocations go to healthcare systems, local health departments, and select pharmacies. The vaccine product usually arrives midweek at the location who received the allocation, however, can arrive anytime during that week. The local health department's main focus for Phase 1A are long-term care facilities that are not matched with a pharmacy and community health care that is not associated with a hospital system. They use the state's prioritization plan to work through these groups. There are some caveats to this plan. In many rural areas, local health departments may travel hours to vaccinate a part of the medical community, and to ensure there is absolutely no waste, they may vaccinate all tiers within Phase 1A at that time. This means that some counties or towns' 1A population may be completely vaccinated while others are not. For anyone administering the vaccine, once the vaccine product is prepared, they are on a time limit and may need to vaccinate in phases or tiers outside the one they are currently in to make sure there's no product wasted. Healthcare systems also receive vaccine directly. They use the state's prioritization outline, but are able to adapt the plan as needed to fit their system. There are many scheduling and logistical considerations that need to be made to ensure proper handling of the vaccine product and a safe environment for administration. We work with them closely to discuss their ability to move through their allocations in a timely manner and adapt allocations accordingly. Not only are they receiving first doses, but they will also receive their second dose at the 21 or 28-day interval and will need to provide second dose vaccine clinics as well. This is a big lift for all of those involved, and I have been incredibly impressed with the innovation, collaboration, and success of these clinics so far. Another point of consideration, that total allocation listed on the dashboard is updated daily. Just because the vaccine product has arrived within the state does not mean the ancillary kits, which hold the personal protective equipment, needles, and syringes from the federal government, has arrived yet. Usually this will arrive within 24 to 48 hours of the vaccine product. Because we cannot guarantee all of these timelines, those who are administering the vaccine need to have the product and ancillary kits in hand to finalize scheduling of clinics. Their goal is to administer the doses within 1 week of receipt. While many claim this process is unorganized, let me assure you, the amount of planning and organization going into this plan is phenomenal. Nebraska is doing an outstanding job. We encourage patience as we move into the next phases, and we will continue to work hard to keep everyone informed on the process. Thank you.
Thank you very much, Angie. Did you have that up? Can you click on the little bar up there, Ryan, and we can pull up that thing? So again, just to kind of highlight some of the things, the 141,000, it was what Angie was talking about. And I think I was told that some of our shipments for this week actually arrived on Friday. So sometimes they arrive early, which is why that number might be higher than what we would have anticipated, because sometimes, again, it just depends on how they show up. But they could have showed, the vaccine could have shown up on Friday, but the needles and syringes and masks didn't show up, so you wouldn't be able to actually administer those vaccines. So that's what Angie's talking about making sure the ancillary kits are arriving with the vaccines, putting them together, making sure it all gets out to the appropriate people. So, and then also just, again, what Angie was saying last week about the next couple weeks being big for Nebraska. And here's the previous weeks, here's last week. You can see that the number of vaccines ramping up really is going, is ramping up there. So thank you, Angie, for the work that all your team is doing and all the local public health departments are doing to be able to get the vaccine out, and all the healthcare systems, all the health professionals. Everybody's working really well together to be able to get this done. So thank you very much for that. All right. So now, one of the things that the Attorney General has made a particular point about, and the First Lady as well, is combating human trafficking. Here in Nebraska, we tend not to think about that, or maybe we didn't think about this in the past, but it really is a modern day form of slavery. And in Nebraska, we may not consider that we're a traffic corridor, but that's how a lot of human trafficking happens. Along Interstate 80, at hotels, rest stops, gas stations, and that sort of thing. And that's why we all have a role to play in combating human trafficking, looking out for the signs of awareness. That's one of the reasons why the Attorney General's office has cooperated with our Department of Transportation to be able to put up, for example, posters in rest areas to make drivers aware of some of the warning signs. For example, if somebody doesn't have control of their own ID, or doesn't have control of a phone, or is acting awkward around other people and so forth. The Attorney General and health professionals work to train, for example, emergency room staff to be able to look for the warning signs and so forth. So there's a lot that we all can do to help combat the spread of human trafficking, and the Attorney General is going to talk about that in just a minute. From the legislature side, this is something that over the course of the last 6 years or so, the legislature has worked on a number of different bills. Starting in 2015, Speaker Scheer introduced Bill 294, LB 294E, which gave victims of human trafficking civil remedies, so to be able to not only pursue it in criminal court, but in civil courts. Senator Pansing Brooks in 2018 brought a couple of bills, LB 289, which increased the penalties for human trafficking, as well as LB 1132, which increased or had some reporting requirements with regard to the victims of sexual assault and how that all related to human trafficking. And then last year, or 2 years ago now, in 2019, Senator Slama brought LB 519, which had a number of different senators' contributions to it. But some of the things in that bill, for example, changed the statute of limitations so that you'd have a longer period of time to be able to bring charges against people in the case of minors who had been human trafficking, been a part of human trafficking, as well as some increased penalties. There as well some new criminal penalties for assault on people if you had been kidnapping and detaining people. So anyway, it was a number of different efforts through the legislature to be able to strengthen our laws against human trafficking to really help assist with that crackdown. So we all have been working to be able to raise awareness, to strengthen our laws, to be able to combat human trafficking here. And the Attorney General is going to come up and say a few words about that as we look to proclaim today Human Trafficking Day and January Human Trafficking Awareness Month.
Thank you, Governor. Real briefly on the vaccine, if I could just add something. Last week, the Director of Health and Human Services in our office sent out a notice to all citizens in Nebraska to be very careful if they're solicited in this vaccine process. Scammers are now becoming active, trying to contact either by phone, by use of the internet, or actually knocking on doors and trying to offer services, vaccine services, and certainly what they're trying to get to is your private financial information. Nebraskans need to understand that, as has been explained, that's not the way this vaccine process is processed. Really what you need to understand is you're best off to go to your health care provider or to go to one of your public health agencies and ask for direction. Do not receive a solicitation and somehow provide information, because that's not how this official vaccine process works. The official process is run through the Health and Human Services, and talk to your care provider to make sure if you're eligible and the proper ways to go about getting the vaccine. Do not try to work with some type of internet service because it's completely a scam. But with that, let me talk about today, this being an announcement both recognizing the month of recognition of human trafficking, and then specifically this day, which is important in the fact that on January 11th, 2007 was the first federal law that went into effect on human trafficking. What's so important about understanding the federal law is prior to the Nebraska legislature, excuse me, in 2015 and subsequent years taking on a specific Nebraska law under human trafficking, we would have had several very important criminal activities occurring in the state of Nebraska that would not have been covered by that federal law, for the reason that all the activity was internal state activity. But because we now have a state law specifically addressing human trafficking, we in law enforcement were in a position to investigate and arrest, and currently have a couple of cases both in Furnas County and Hall County where it appears very, particularly in Furnas County, very much within just a limited state of Nebraska. And it wouldn't have met the jurisdictional requirements for federal authority, but because the Nebraska legislature did the hard work of getting the legislation passed, we're now in the process of prosecuting those cases, and with significant penalties if we're successful. And that's why I think it's important to acknowledge, although it's a federal recognition, also to recognize on a state level what was so important in passing our human trafficking laws in the state of Nebraska. In our office, I want to recognize Glenn Parks. Glenn is our director of the Nebraska Human Trafficking Task Force, and then two really key players, Annie Boatwright, who is, she's our official sexual assault nurse examiner trainer, but she has a real heart for this and has been engaged in human trafficking for a long time. So she's a key player, along with Anna Brewer, who's our lead investigator. And Anna is basically traveling all over the state, helping local law enforcement agencies, state law enforcement agencies, and federal, based upon her years of extensive experience in human trafficking. I'm very proud of this team, very proud of the services they offer. You don't have to work on this team with a first name of starting in ANN, but it helps if you're an Annie or an Anna. They've done an excellent job, and Glenn has done a great job with our regional teams across the state to help fight this. As you see, we issued a report each year, and so we've issued our 2020 report. And if you look at that you can go to our webpage, ago.nebraska.gov, and you'll see under our tab for human trafficking both this report, and you'll also see some of the statistics of how we're seeing a significant increase in human trafficking. I also want to thank, there's a lot of really important agencies, and if I start, and individuals, if I start going down this, it's going to be hard to stop. I do want to thank our partners in Nebraska State Patrol. Nebraska State Patrol has been a vital player as we've done investigative work here. Also, the child advocacy centers across Nebraska, excuse me, have also been a great partner. And then there's a lot of community service organizations that have a real heart for providing the appropriate services for people who are victims of human trafficking. So with that, I would just say thank you to all of the agencies and individuals who've been committed to this effort for many years. I think we're starting to see some real productive results from that. The last thing I would mention is, as far as legislation, I think Senator Slama does have a bill where we're requesting that those who have been convicted of human trafficking would be required to be on the sex offender registry. And so Senator Slama is introducing that bill. And finally, I just want to thank the governor, and I want to thank the First Lady, because you've been strong supporters of human trafficking. I remember Suzanne on the campaign trail when I first started talking about this, how interested you were. So we've continued to have a dialogue now for almost 6-7 years. And the state of Nebraska has gotten behind this. This is important to us. State senators have gotten behind it. Special thank you to Senator Pansy Brooks and the efforts that she's made. So it's been very much a team effort, and I'm glad to say, as you look at our 2020 report, we're making some real progress, and that's due to everyone getting behind this. Thank you very much.
All right, thank you very much, AG. Quickly, since we don't have our masks on, we're going to be very quick about this. I'm going to sign this proclamation. We're going to take a picture. Proclaiming it Human Trafficking Awareness Month. All right. All right, you can take that with you.
Thank you.
Thank you. Oh, except, did you take my notes? You took all my notes.
You want me to do your speech?
Oh, okay. Yeah, those are mine. Thanks. All right. Oh, I still got some of your notes. That's okay. I'll return them to you later. All right. So before we get into questions and answers, again, we have a press briefing scheduled for this week is a little bit different. We have a press briefing at 10 a.m. tomorrow here. And then Thursday, 10 a.m. in the legislative chamber will be the State of the State address. So the schedule is going to be a little bit different for this week. And Taylor, I don't have any written questions up here, but do you have questions that were submitted ahead of time?
Yep.
Okay, great.
The report says, we know there was a concern for a potential surge in cases coming out of the holidays. How would you assess what we have seen in that time in terms of case numbers? Anecdotally, has contact tracing revealed outbreaks tied to the holidays?
Great. So Henry Cordes from the Omaha World Herald is asking about case counts, and since the holidays, have we seen an increase? I believe we've seen a small increase in the number of cases so far since the holidays. However, I think that in general, at least anecdotally, talking to folks, I heard that people had modified their get-togethers over the holidays. Certainly my family modified our get-togethers. So I think other people did the same thing as well. And again, just want to ask Nebraskans to continue to stay focused on taking all the steps to be able to slow down this virus, use the tools we've given everybody to be able to do that. And to my knowledge, Angie, I'm going to look at you a little bit too, and Taylor, I don't believe we have anything in the contact tracing that shows anything different from what we've seen in the past, except that a lot of this is coming from, again, those small informal gatherings where a lot of the virus is being spread. Angie's nodding her head yes, so.
And Ashley says that, yeah, nothing is definitive observed in the contact.
Yeah, and contact tracing really hasn't observed anything differently. So I think if there is an increase, it may just be people were getting together more, but hopefully people took those steps and we'll be able to continue to slow down the spread of the virus.
Ruda from KMTV says, just to clarify, when is the registration website and call center expected to launch? When can people that are 75 plus start making appointments for vaccination?
Rusa Alzanaya from KMTV wants to know when will the website be up and the call center be open for people who are 75 years or older to be able to talk about that. We will have more information on that next week, so there's no date set that we're prepared to talk about today. Angie, unless I know something different, you know something different if I know. Nope, that's right. Okay, so stay tuned. We'll get more information on that next week.
Don Walton says, after a weekend for reflection, what do you think prompted the armed attack on the Capitol, and what should we do now?
Don Walton asks from the Journal-Star, after a weekend of reflection, what do you think provoked the attack on the Capitol and what should we do now? I would say a couple things. One, I think it demonstrates there's still a lot of people who are skeptical of the election results, and that's why I think it's incumbent upon Congress to take steps to be able to ensure election integrity. I think that they, some of the senators were asking for a commission. I think that would be a good idea to be able to assure voters in the future that the elections are fair and that the results can be trusted. I want to, again, just congratulate all the folks here in Nebraska that worked so hard, our Secretary of State, our election commissioners, and all the folks who volunteered at the polls did a fantastic job, and I have no concerns about the results here in Nebraska with regard to that. So I think we've got a great system here in Nebraska. I think it also demonstrates that there's a lot that people are unhappy about with regard to just how the country's going, that a lot of middle-class folks are looking for our government to set policies that are going to prioritize people in America first when it comes to trade and the things that President Trump did with regard to making sure that we're moving manufacturing jobs back to this country. I think that that's all important things to make sure we continue to invest here in this country, that we make sure that we're creating jobs for Americans.
Paul Hamels has a series of questions. He says Nebraska appears to have dodged a bullet and hasn't seen the post-Christmas surge in cases that other states have. Why is that?
So Paul Hamill is from the Omaha World Herald, has a series of questions, starting with, we haven't seen the big surge of cases since the holidays as other states have. Why is that? And again, I think there's a lot of Nebraskans have made modifications to their holiday get-togethers. I would also say there's probably a lot we just don't know about this virus. I mean, look at, for example, when we had the surge in the Midwest here over October and November, you had states that had very hard shutdowns like Minnesota and Illinois that were impacted very similarly to states that were less restrictive than like Iowa and Nebraska. And certainly right now, if you look, California, which has been a hard shutdown state for almost a year, is seeing their average case rates are more than double Nebraska right now. So I think part of the danger is when you do these hard shutdowns and do them in a sustained way that people eventually get fatigued. It's certainly one of the things that we talked about March of 2020, the potential for the public become fatigued if you have really strict shutdowns, and that's why we've tried to strike a balance here in Nebraska.
Paul also wants to know, what is your level of concern about protesters storming the state capitol on January 17th? Have you asked for additional security?
So Paul also wants to know, what's my level of concern with regard to protesters storming the Capitol on January 17th? Take a step back for folks. There are some handbills and flyers running around from a national group calling on protesters to go to state capitals all across the country on January 17th. Certainly we will take the appropriate precautions here in the state capitol with regard to that. I will also note that the protests we had here last week were peaceful, and I encourage anybody who wants to protest to continue to do it peacefully. That's the American way. The violence that we saw either at the Capitol last week or last summer is not the American way. That's not how we protest here in this country. It needs to be peaceful.
What is your decision about what is your opinion about Twitter's decision to ban President Trump?
Paul is also asking, what's my opinion about Twitter's decision to ban President Trump? Obviously, Twitter, being a private company, can set its own policies with regard to that. And as long as they're not discriminating against somebody, against race, creed, color, that sort of thing, they certainly have the ability to be able to ban people on their service. However, I think the more that social media platforms are doing these kind of things, the more that they're just really going to be facing in the future additional regulation. I think there's probably going to be more investigations in this, more regulation with regard to those social media platforms as they, decide who they're going to allow to be on and who they don't decide they're not going to allow to be on.
Can you comment on the decision to commit $50 million towards the possible location of Space Force headquarters in Platt Offit? Would that money come from the cash reserve or elsewhere, and will that hinder property tax relief?
So Paul also wants to know, he did have a series of questions. Paul wants to know the $50 million for Spacecom, where is that going to be coming from, and will that hinder our ability to deliver property tax relief? I will say, first of all, we are going to be talking about the budget and releasing that, my budget recommendation, on Thursday with the State of the State address. But by prioritizing, continuing to control our spending, and focusing on the priorities of the state, we can be able to support Spacecom and property tax relief as well.
And then finally, Sarah from NTV asks, have we had any coronavirus vaccine expire before going into people's arms? If so, how many?
Sarah from NTV is asking, have we had any coronavirus vaccine expire before getting used? And if so, how many? And then Angie's saying, no, we haven't had any that way. And again, I just want to highlight what Angie mentioned in her remarks. You know, we are giving public health departments the discretion in their local areas to be able to manage this, right? The state has set our priorities, and the public health departments are following those. However, in certain areas, they may be moving through a group faster than what may be happening in a different public health department. And, of course, I certainly support that if they're going through the, you know, a vaccination process, and at the end of the day, they've got half a dozen, you know, vaccines left over, they're not to waste them. They need to get them into somebody's arms. So it may not be the person who's exactly in the group that they were looking to inoculate, but we're going to make sure that that vaccine is not wasted. Anything else you want me to add on that one, Angie? You good? All right. All right, so that's all the questions that were sent in? All right, questions from the audience. Martha?
On the human trafficking, the legislature has considered, in a number of different years, providing some funds for services for people who are the victims of human trafficking, and it's never gotten passed, it's never made it into, in the priorities. Is that something that you would support?
So Martha asked the questions. In the past, legislators have proposed providing funds for services for the victims of human trafficking. However, it's never made it into any of the bills. And, you know, it really just depends on the specifics of that, Martha, with regard to what people were proposing. I don't recall any of the specifics off the top of my head with regard to what those specific proposals were. And if people were to make those proposals going forward, it would, again, depend on the specifics of what those proposals are. Obviously, there's already resources out there in some cases. Attorney General, I'd invite you to come up if you had any thought that you would like to, any comments you'd like to make on that?
I'd say, as to service providers in Nebraska, we're fortunate in the fact that we have several nonprofit organizations that have really stepped up and have made this a priority for their funding purposes. So they're to be applauded, and the supporters of those nonprofit organizations are to be appreciated and applauded for the fact that they're helping address this, both Lincoln, Omaha, and statewide. Yes, obviously we have to be a little bit more specific, but I certainly support the state's willingness to help these service organizations because, as many nonprofits, funding is always a challenge.
I saw you that Forest County and Scottsbluff, you had investigations there. Where are you seeing some of the more, I guess, maybe some of the education, some of the focus on human trafficking going out through the state now?
We've had a pretty, in the last, oh yes. Andrew Osaki asked about where do we see some of the training with regards to awareness of human trafficking and labor trafficking. We've been, and it's been led out by Glenn Parks and other organizations asking for training, but we've been doing, for 4 years, we've been doing extensive training. Anna and Annie have also been engaged in that. I think one of the most important areas that you can go to special segments. You can go to the medical community. You can work with schools and get them to have a greater awareness of what to look for. Probably the biggest challenge is just the overall public. Now, if you go to our webpage, ago.nebraska.gov, we have signs to look for. We also have videos in there. Posters are going up, again, in all the Nebraska rest areas along the interstate. So we're trying to get people to go to our webpage to explore more about how to identify both sex trafficking and labor trafficking. But I would say we're always going to be challenged with making citizens, for example, in the hotel industry, and someone comes in, there's certain signs that if the hotel industry people are properly trained, they're going to pick up on that. But what about in the general public? At a convenience store, a situation that looks a little bit odd as to the way this young girl is dressed and the way the older man is handling her money. things like that. Those are going to be challenges. Our hope is that the videos and the information we have on our webpage, if people are interested, would be a big help. And continuing to go out to community programs and try to speak there also.
So are these investigations that you've been working on started from the public tips, or is it from investigative leads that you guys have had?
You know, I might have to look to Anna on this, but I think both of them were tips made to local law enforcement that came to us afterwards. I think some suspicion of what people saw and brought it to the attention of local law enforcement. And because we've developed a regional network across the state, a different region task force, that was brought to our attention, I believe, in both those cases. Martha?
Of the cases that you've worked on, which are you seeing more of, the sex trafficking or the labor trafficking?
Sex trafficking. And with regards to the labor trafficking, it's very important that people be aware of it and make us aware. Typically in the labor trafficking, there's a much more interstate element to it. And so Homeland Security, the federal agency, is a really important partner. And if we have enough information that it makes it clear that there's interstate activity, typically Homeland Security will take the lead on that. But as far as volume, Martha, it's for 2020, it was definitely in the area of sex trafficking. Andrew.
Doug, on another matter, how much did you know about, any of the activities with the Republican Attorney General's Association or the Defense Fund?
Right. Had absolutely no idea, nor did any of my peers in the, that I'm aware of in the Republican Attorney General's Association. Didn't know about it until Thursday afternoon. And the irony was, I found out from another Republican AG, and I was talking to him about developing a bipartisan letter. I was working with the Colorado Attorney General about a bipartisan letter denouncing the violence that took place. And so I'm in the process of trying to develop a bipartisan, and then I hear about this issue that came out with regards to the robocall.
And do you think that was proper of this organization? Is that something you will be looking at?
Yeah, once this, as I said, this wasn't a decision made by attorney generals. And once we became aware of it, the executive committee is in the process of doing an investigation, and I think we'll know very soon the results of what they found out. But it's preliminarily my understanding it was a staff person that got engaged in doing this without seeking approval from the attorney generals, and so it's very concerning. I think one other thing about the senator's public information request, that's a very easy question to answer because there's absolutely no communication, no records. She suggests that the answer's too quick. Well, the answer's pretty quick when you know you had absolutely no time. You found out late Thursday afternoon this had happened. So it's unfortunate. Wednesday was really a dark day for all of us to see our state capital or federal capital attacked like that, and very concerning. And that's why I think it's really important for us AGs, both Democrat and Republican, to issue a letter, and I think we'll be doing that soon, indicating to the U.S. Attorney that we want to see full prosecution on all offenders.
And does that prosecution go on to any public officials that may have possibly incited this?
You know, the question was whether or not the prosecution goes on to other people who might have incited that. That's going to be up to the U.S. Department of Justice and the FBI investigation as to what, who was responsible in what way. So I'll leave that to the U.S. Department of Justice.
And are you aware of any Nebraskans who may have been involved in the goings on?
No, I'm not. Anything else? All right, thank you.
Took my notes again, AG.
Just says Q&A.
All right, any other questions? Okay, I don't see any other questions.